to be prioritized in Nigeria's health security space? What is our focus on this week's episode of Health Options? Make sure you are part of our Nature's Corner as we take you through medicinal plants that could be used to treat malaria the natural way. Thanks for joining us on the program. I am Rabi Abdullah. If you are just joining us, this is Health Options, the program that not only tracks government's policies on health, but helps you with the information you need to make informed choices about your health. With a new government in place, what are the priority areas for the nation's health security space? Let's now join the Director General, Nigeria Center for Disease Control and Prevention, Dr. Ifedayo Adetifa, for insights.
If I'm asked about what we need to prioritize in the health security space, I think I have a short list of maybe 5 or 6 points. So the first is the National Action Plan on Health Security. As you know, that plan that was written 6-7 years ago expired this year, and we are in the process of preparing a new plan. I think it is important that the investments in the action plan for health security continue because the previous plan, despite all of the investment and the enthusiasm, was not implemented to the extent that we require. And given that the health security master action plan is an all of government, all sector, all people driven, it is important that investments in that plan are made available because the implementation of that plan will deliver the resilience, everything that we need in terms of emergency preparedness and response as a component of course, even healthcare in general. Indeed, increased funding to healthcare at all levels is also the bedrock on which some aspects of health security rest on. So we need more budgets for, even if it's just to meet the Abuja declaration of 15% of annual national budgets to the health sector in general. And then we need the costed national action plan on health security to be implemented, which is not just about the health budget, but also investment in animal health through the Federal Ministry of Agriculture and Rural Development, investment in the environment through the Federal Ministry of Environment, and in the Health Ministry, Armed Forces, and other partners.
Do you know that Nigeria has what it calls the Joint External Evaluation, a platform health authorities are using to identify gaps in the nation's health security space?
Nigeria had a joint external evaluation in 2015 and had a midterm review. Our readiness score was 37, and then that increased to 46, driven by improvements in things that we consider response. Okay, that's the things that you do when an emergency actually has happened. We didn't move the needle at all in terms of things that are related to preparing for an emergency. Consequent to that and outbreaks that have occurred, including the pandemic, we've had significant investments, perhaps in a short time, but more than ever before in the health security space across sectors. Thankfully, we are now in the process of conducting another JEE. As you know, joint external evaluations are sort of health security capabilities, are commitments, legal commitments that governments or member states have entered in adhering to provisions of IHR, the International Health Regulations of 2005. And I think that the new government and our principals, when they arrive, will be uniquely positioned to see the results of a brand new JEE that tells us how well we are doing and also identifies the gaps that require attention. And I will if I'm asked to be recommending that all the gaps in all of the 19 technical areas and the related indicators that are identified in these joint external evaluations automatically become a prescription for the government and all the relevant MDAs to take on board. The One Health philosophy is one that recognizes that we can only safeguard human health by appropriately taking account of the health and well-being of the animals that share the environment that we also exist in. So anything that happens in animals needs to be looked. We need to keep an eye on that. We need to also make sure that, for example, in animal husbandry, you don't abuse antibiotics because you want animals to have more meat, but then you put them at risk of having pathogens that are antimicrobial resistant, and even worse so do that for the human beings that consume the product. So we need more investment in One Health, and particularly because most of the pathogens that are on any global or even our national list of priority pathogens, more than 70% of them are pathogens that primarily affect animals, what we call zoonotic pathogens or zoonosis in terms of illness. And what has happened with time is given the activity of humans in the environment, reducing the distance between us and animals, we are getting more zoonotic illnesses. COVID or SARS-CoV-2 virus is a zoonotic illness. Monkeypox, or Mpox as we call it now, is a zoonotic illness. Lassa fever, zoonotic illness, and so on. The list goes on. Marburg, Ebola, even anthrax, which the only difference between anthrax and these other pathogens I've mentioned is that that's a bacterial pathogen, while these ones are viruses. So all of these primarily affect animals, but have the ability to also affect human beings. And we predict that many of the causes of public health emergencies will be zoonotic illnesses. So in preparation or in response to that, we need to make sure that the One Health approach works at every level. I think my predecessors or our predecessors in government, we can say, have been quite visionary in terms of the way they set out the mandate for the NCDC. The NCDC, by law, is actually mandated to conduct our work in health security using a One Health approach. So there's a One Health technical working group at national level. There's a national One Health information sharing system and the like, where we've done a lot of work using World Bank funding through the Ready Safe project to strengthen One Health in terms of coordination, in terms of system and surveillance strengthening. There's still quite a bit to do, but even more so at our subnational level.
What should be the nation's response to that?
We have a good relationship or good thing going on at national level, but until we replicate that in every state or even in every local government, then we will have a challenge, and that's we have a lot of work to do in that area to make sure that that philosophy percolates down, but all of these coordinating structures are also replicated as appropriate for the context and at all the subnational level, so that we reduce the risk of public health events that are due to zoonotic pathogens. We will only be as strong as our weakest link. Okay, we need to pay attention to what's going on in health in general and to health security at our subnational levels. Some places are doing well, some places are not doing well. A lot of it is also related to a capacity, the kind of capacity you may have in the Lagos State Ministry of Health will differ if you go maybe to my state or go to, just in terms of numbers, in terms of skilled personnel, and in terms of being able to pay for the staff that you want. We know that there are states in the country where maybe the public sector or government maybe has a handful of doctors in employ. Okay, so if you have a handful of doctors in employ, it means that you also don't have enough nurses, you also don't have enough pharmacists, you don't have enough medical laboratory scientists, and so on and so forth. And to compound that situation further, you probably don't even have enough of what they need to work with to deliver quality or appropriate health care to citizens. We also know that even outside of our urban centers or conglomerates, most Nigerians still live in rural areas, many of them quite far, or some of our states actually have really large land mass, and to travel from one point to the other is significant. So we need basic primary health care accessible. The original dream was that there would be a primary health care facility within 5 kilometers of everybody, so that, if push comes to shove, maybe you can have a short stroll or so. So we need to do that. And then we also need to address, and I'm glad, I think that's already part of the president's agenda. It's not just to get to the primary health care center to find a building, but to also make sure that the efforts that have been started in revitalizing primary health care, for example, and even setting up model primary health care centers that deliver a basic but comprehensive package for that level are put in place and are made accessible to citizens at every level. And this starts in the subnational space, at local government, at state level.
Are there laws to be revised for effectiveness and efficiency when it comes to health security?
Yes, there's a lot of work that needs to be done in the, if you want to call it, health regulatory space. There's a need for regulation even in the use of what should be prescription-only drugs. There's a need for better regulation and enforcement of regulation in the food space, in our whole food chain from farm or from abattoir down to consumers. So there are areas that need intervention. In some cases, and I can't speak authoritatively on food and drug matters, we have to identify whether the problem is an absence of regulation or actually enforcement of regulation. Sometimes we focus on delivering good guidelines and good regulations, but forget that you need not just human capital, but even further investments to make sure that that process is enforced. You need investment, for example, in policing if you want to keep down crime. Okay, if you do not equip public health or environmental health units to do their jobs, then they can't enforce regulation. Colleagues will end up, doing the little that they can do, spend the day in their offices, and that's part of why perhaps we tend to see more action in response when there's already a problem. Because of course there's a problem, there's a lot of clamoring for action to be taken, and then investments are provided or resources are provided to do that. But the work that needs to be done in the background, that tends to be invisible, does not make the headlines, that is preparedness. That is the stuff you do to set up a system to make sure that routine reporting works, that tracking works, and all of those. Those require sort of normal baseline funding. The funding, so, in sectors, whether it's to agriculture or to environment or to health, so once you don't have appropriate budgets, for example, quantum of resources made available in annual budgets, then you, to an extent, automatically restrict the scope of work that can be done, even for already written down and existing mandates. And that's the challenge. And obviously, I speak from a point of view where I'm asking for more. There needs to be a balance between your income and all of that. But I think also quite a lot can be achieved if some slight reprioritization is done. We have to recognize that health security is an economic matter. I think COVID-19 as a pandemic has highlighted that. It's an economic challenge, it's a health challenge, it's even a social challenge. We had mental health challenges, we had sort of loss of income, countries went into recession, we had disruption of education and all of that. Can you imagine a scenario where perhaps you have a really bad outbreak of some condition that leads to internal displacement or people having to move across borders. It's not only wars that cause those things. So health security is indeed national security, national economical, whatever sector you want to look at it. It's of relevance to that. And perhaps if it is looked at in that way, in relation to GDP, in relation to income, in relation to productivity, then maybe it will be slightly reprioritized or reprioritized somewhat differently to receive more investment.
What are the low-hanging fruits?
The new government is also lucky in some respects. So I talked about within a few months of resuming and even having ministers, you will have the results of a JE available and you can see what's going on, accurate report of what's going on in the health security space and the gaps that you need to identify. And you could just adopt those gaps as your target for the next period, and I think citizens will be happy with that. So the next point I was going to make in relation to that is that the previous government also did conclude a health sector reform process. Okay? A final report was delivered and was completed and delivered to President Buhari before he transitioned out of office, and it's a compendium of situation analysis and action points to implement, okay, which I think is, not every government gets, as part of your handover notes, a proper description of, look, this is where we stopped, these are the problems, please have a look at them. So I think the current government, both in alignment with President Tinubu's health agenda, will have enough of evidence and recommendations to select priorities that they would want to work on in a period.
Now, the Basic Healthcare Provision Fund has a health security component. Check it out.
It's a Basic Healthcare Provision Fund, which again I think is a very visionary idea when it came to when it was put in place. So, from the perspective of the NCDC and health security, a few weeks ago, I think maybe 2 weeks ago, the Ministerial Oversight Committee approved the NCDC gateway and the guidelines and the disbursement that needs to be made. So that's done. The plan in the guidelines to use the funding, one, is to, most of the funding will be put aside, I think it's 60%, to go towards supporting public health emergency operation centers, operations in states. So this will be shared across all states equally so that they have a small operational budget to overcome sort of some of the challenges with fueling, with electricity and all of that often impedes the operations of a public health emergency operation center. Some of that funding will also go into a public health emergency operations fund, which means that for the first time, Nigeria basically now will have a pool of funds that can be mobilized to investigate, confirm, or respond to any public health emergency that does not suddenly require need for extra budgetary mobilization or other efforts that have been often have to be deployed to provide money for response. And because the BHCPF is a recurring source of income, and this proportion will keep going into that pot of money, we would always now have some funds available to at least start off any response that as may be required for a public health event. The other thing is that we now would also have resources for some programmatic work, but one that is required especially for NCDC's coordinating and convening or secretariat role for things like AMR, for One Health, for chemicals and all of that. I think in we were so focused on setting up those mechanisms of employment that one actually forgets that you need to hire people and you need resources to actually properly manage this secretariat in a way that doesn't mean you are looking for where to get paper or devices to write minutes and to share information as the case may be. So it was very, very good development.
It is now time for us to go over to our nature scanner for a peep into some medicinal plants that can be used to treat malaria the natural way.
Here are arrays of different products here. For the purpose of this thing, we will leave out the big teaching grammar of chemical name like alum sativum, which is garlic. We will prefer to say garlic today, not alum sativum. And alum cepa, which is onion, so we prefer to use onion's name today. And this is a mango. This is a lemongrass for our viewers. This is a zogale, moringa, oleifera, and then this is Veronia amygdalene, our popular bitter leaf, our popular grape. Grape is a fantastic, be it the fruit, the skin, and the flesh inside. This is a great one. And then our water leaf. Small water leaf, but very, very powerful. And then, finally, for those ones that are valuable, this is our scent leaf, the all-powerful scent leaf. And then, coconut. Sometimes this mango, by boiling, the active ingredient is extracted from the water and drank, and it has effect on the malaria parasite. The onion, very fantastic in measles, in malaria. When these two are intricately mixed, it will bring down the temperature of any malaria. Garlic is a godsend spice in malaria, in some temperature-related issues. Onion and garlic, when they are combined, they stand as a very strong antibiotic, working very well against the malaria parasite. So also is the coconut. The dry of the back, the inside, the water, the flesh come together. Gives you a fantastic anti-malaria, all on its own. So that means consume everything inside here. It's fantastic. Then when you talk of bitter leaf, when you mix them, this combo here, malaria is gone. Even on its own, malaria is gone. Bitter leaf. Veronia amygdalene. The grape. When the various types of grapes are mixed together, you have the best anti-malaria product. When you come to lemongrass, simple mixture of lemongrass can give you cure for malaria, prevention, cure. You make it dry it and make it in a tea form and be making the tea and drinking. This can be used with zogale, it can be used with scent leaf, and all the hemorrhagic fevers, it deals with them. And you boil them together, or you dry and mix them together. Water leaf and bitter leaf can be combined. The onions, the various varieties of onion can be combined. And beyond the malaria, can take care of so many things for both preventive purposes and curative purposes. In all this, you get prevention. In all this, you get cure.
does it on this week's episode of Health Options. You can go to our YouTube channel to watch the upload of this and other episodes of the program. I am Rabi Abdullah. Thanks for watching. Hope to see you again. Until then, do stay safe.